Hello, I'm Fernando Valenzuela. I'm a dermatologist from Chile, and today I will talk about the complementary strategies in psoriasis, some non-pharmacological approaches to our management of the patients with this disease. Those are my conflicts of interest. Really, none of them is important for this talk. We know that psoriasis is a chronic immunomodulated condition and it's an inflammatory disease. And there is a dysregulation on TNF alpha, interleukin 23, and interleukin 17, provoking that keratinocytes start to hyperproliferate and we have some impairment in the epidermal barrier. But we know that it's not only a skin condition, and for sure, all the cytokines will conduct to comorbidities in our patients. So this population suffers from obesity, diabetes, metabolic syndrome, cardiovascular disease, inflammatory bowel disease, psoriatic arthritis, and depression and anxiety. But something that we usually don't talk to the patient quite well is the role of the nutrition. We know that our Western diet is really a pro-inflammatory one. We usually intake a lot of omega-6, calories, trans fats, and we usually don't eat a lot of fibers and antioxidants. So we have basically two kinds of diets that has been explored. We have the Mediterranean diet, which is rich in vegetables, fruits, whole grains, and healthy fats. And this diet is anti-inflammatory and it is associated with a PASI reduction and metabolic comorbidities improvement. On the other hand, our usually Western diet is really very high in omega-6 and excesses of calories and trans fat, which means a pro-inflammatory diet, exacerbating the immune dysregulation and increasing some of the pro-inflammatory cytokines. We don't have to remember that we also have that microbiota in our gut and fibers, vitamins, and polyphenols. So the Mediterranean diet will modulate the microbiota, playing really a good role in the psoriasis pathogenesis. So it's important for our patients to understand that if they are able to eat in a good way, in a healthy way, we will help diminishing not only our comorbidities, but also psoriasis itself. Let's talk about the vitamins because some of our patients will ask for them. And starting vitamin D, we know that the deficiency on vitamin D is really frequent and we can have an oral supplementation, but the results on PASI are controversial. We also know that when the patient goes into narrowband UVB, we are able to increase the levels of vitamin D and reduces this IHS-CRP. So there is a role, but it's not recommended vitamin D as a monotherapy. Regarding vitamin E, we know that it's a lipophilic antioxidant vitamin, and the lower levels are correlated with poor province cardiovascular conditions. So it's important, but of course, it's not all a monotherapy on psoriasis. Regarding vitamin B12 and B9, we know that hyperhomocysteinemia is really frequent in our patient, leading to an increased risk in metabolic conditions. And also it correlates with higher PASI scores, the activation on Th1 and Th17 pathway, and the depression on Tregs. So even when the benefit is not established, we have to monitor the levels on those vitamins. And finally, the vitamin A or retinoids, there is some genetic susceptibilities, and acitretin is useful in some of the pustular or erythrodermic forms of psoriasis. And also vitamin A has a fungistatic effect, but we know that it can be toxic, and we have the teratogenicity on vitamin A. When we talk about the trace elements, think it's lower in patients with psoriasis against controls. The copper is increased in patients with psoriasis, and selenium is usually diminished in this population. And the copper zinc ratio is elevated in patients with psoriasis, and this is a marker of chronic oxidative stress. So it's important to take account on that. And the lower levels on selenium, it's inverse correlated with the PASI severity. So when we are able to supplement with selenium, Q10, and vitamin E, we can increase or improve some of the PASI levels in patients with erythrodermic or psoriatic arthritis. Even when the selenium supplementation has inconsistent results, we have to take in account those trace elements. Regarding exercise, this is crucial. This is the most important message on this presentation. We can diminish the PASI in 48% by doing a very good exercise. We know that when our patients are in under exercise, we are able to diminish the adipose tissues, diminishing the pro-inflammatory cytokines. We're able to increase the adiponectin, so the inflammation diminished. We are able to increase the antioxidant gene expression, diminishing the oxidative stress. And also, we are able to diminish the insulin-leptin ratio, improving the metabolic resistance. But we know that there are some barriers for the patients to start exercise. Most of our patients with psoriasis do not meet the AHA guidelines for exercise, and this is due to skin sensitivity during the exercise, the social stigma on psoriasis, and the higher PASI correlates with lower activity. So it's crucial that we have to educate our patients to start doing exercise and the importance on the severity of the disease. And for obese patients, the bariatric surgery really is a very, very good option. We can have 70% in remission after 6 months of bariatric surgery. So it's a very good option in patients who are really obese. We know, on the other hand, that there's some issues with the bariatric surgery because our patients will start to have lower levels on vitamin D, vitamin B12, selenium, iron, zinc, and calcium, causing some disturbance. You can see on your screen. And most of them are really lower now with the GLUT1 therapy, which will for sure revolutionize all our treatment on psoriasis. I will not touch it because I prefer to do only non-pharmacological indications here, but for sure it's something that we are looking for and waiting for more data. Regarding mental health, it's crucial. We have to promote our patients to tell what about anxiety, depression, and suicidal ideation, because unfortunately, most of our patients can suffer from some psychiatric condition. So during all of our follow-up, it's important to provide like a really safe space to talk on these conditions and a really honest setup. This is important because the pro-inflammatory markers, our cytokines, increase the risk of depression, anxiety, and also schizophrenia. And for sure, the social stigma will amplify this psychological impact, and for sure, it will reduce the adherence of our treatments and also the adherence on exercise and the diet. So the recommendation is to active screen for depression, anxiety, and suicidal ideation on every visit. We can use cognitive behavior therapy to improve the adherence, for sure the referral to psychiatrist. The support groups are really a very good option. Patients feel better talking to a similar patient, and the education for sure, and the approach on dermatology and psychiatrist. talking about the quality of evidence and our limitations, we have very low evidence with selenium and zinc supplementation, a low evidence on vitamin E and B complex, a little better with vitamin D, low to moderate to the Mediterranean diet, and the best evidence is on aerobic exercise, weight loss, mental health, and bariatric surgery. We know that most of those studies with evidence are observational, small designs. The sample size is very heterogeneous, so it's difficult to standardize the interventions. And for sure, we have a lot of confounders such as the BMI, comorbidities, etc. So we don't have really good evidence-based clinical guidelines for supplementation. However, it's very important to talk about those topics with our patients and to provide the better care we are able to. Uh, Integrating those strategies, the weight loss, the macronutrients, the Mediterranean diet, the exercise, and mental health, all of those strategies are complementary to our pharmacological treatment. So they will never replace the pharmacological treatment. However, they will help our patients to have a better quality of life and a better adherence to our strategies. That's all I want to tell you. Thank you so much for your attention.